Please take a moment to review the table of contents. The purpose of this presentation is to personally reflect on a time when there was miscommunication within my organization and discuss the variables that led to this occurrence. I will discuss the culture and values within my organization and how these values and cultures play a role in the everyday flow through patterns of meaning, patterns of relating, and ways of talking, listening, and mindfulness. We will discuss innovation and how misunderstanding is sometimes required for innovation to occur. We will reflect on patterns of meaning, relating, and ways of talking, listening, and mindfulness, and consider how recognizing these variables can change our conversations and situations. While working in the pediatric critical care unit, I was taking care of a toddler diagnosed with croup secondary to a viral infection. One thing to note is that children with croup can be volatile at times due to the critical airway that they can have, which means if a kid with croup is sick, he or she cannot be placed on oxygen due to the possible constriction of their airway. A new cohort of interns had just started working the night shift and covering for the attendings overnight. The patient I was taking care of had IV access and had already received a dose of IV steroids along with racemic epi nebulizers a few hours prior to being admitted to the unit. The patient was calm, sleeping, and started dropping her oxygen saturations to the 80s. With any other patient, oxygen would have immediately been initiated to maintain saturations above 90%. However, I knew that because the kid had croup, that would not be the case for this patient. I noticed the intern walking down the hallway and went and asked him to come assess the patient. In my mind, I thought that the patient needed to be transferred to a more critical care unit to be placed on Heliox. When the intern got to the patient's bedside, he assessed the patient through the window and noticed that she was sleeping. The intern stated it was okay for her sights to remain low as long as they did not fall below 87%. Throughout the night, the patient continued to decompensate and drop her oxygen saturations, to which I could do no intervention. I paged the intern multiple times regarding the situation, asking for IV steroids, nebulizers, and anything that could help the patient. Each time, the intern responded with no concerns regarding the patient. Eventually, our charge nurse had to reach out to the attending regarding the situation and this patient. After this, the patient was transferred to the ICU and stabilized. However, the intern who had been communicating with me all night long called me in the middle of a report and was completely surprised by the fact of all of this information, to which I communicated that this patient had croup and I had paged him multiple times asking for intervention. The patient's airway was highly fragile, so I asked for all the interventions such as IV steroids and nebulizers. The patient was stable and later was able to be discharged home. However, the situation could have been a lot worse than it was, resulting in harm meeting the patient. So, how did miscommunication occur? First, frustrated or flustered staff. In critical care units, the demands of patients can be overwhelming sometimes, which can easily cause frustration. It also didn't help that this was the intern's first night working and dealing with such situations as these, which I'm sure caused him to be flustered. However, as a bedside nurse, when you're constantly giving your concerns to the doctor and you feel as if you aren't being heard, that is very frustrating for us as well. Secondly, inconsistent reporting or failure to approach the intern properly. The first time I communicated with the intern, I should have paged him or given him a brief history of the patient or given him time to look up the patient. This way, the intern could have had the whole story regarding the patient and able to see medications and interventions that worked prior to being admitted, which would have helped get me some interventions to give the patient. Third, failure to investigate. As a bedside RN, I should have urged the intern to go into the room to assess the patient face-to-face instead of looking through the window to assess the patient. Getting the physician to see the patient would have helped the intern understand more of the patient's diagnosis because with croup, the shriterish noises they make, especially when they sleep, are very distinctive. Next, incomplete or inadequate handoff reports. The intern was not relayed in handoff that this patient had croup. I automatically assumed she knew because of the patient's submitting diagnosis. However, the intern was focused on the fact that the patient had a common viral respiratory illness, which is why he wasn't concerned with the low O2 sats while the patient was sleeping. Lastly, my charting could have been a lot more clear to the intern. To the intern, my charting made it seem as though the patient only had one desaturation event every hour to the 80s, when in reality the patient's O2 sats were consistently sitting in the 80s. Since 1911, my organization has provided specialized medical care for ill and injured children. With more than 3.5 million square feet, my organization is one of the largest pediatric medical facilities in the United States. The organization aims to provide the finest pediatric health services to all children in an environment that fosters excellence in research and medical education. Being an employee of this organization means advocating for all children and families. The values of my organization include trust, teamwork, compassion, innovation, and commitment for patients, families, and employees. Conversation themes within my organization include having inconsistent providers. Coming from a large hospital, there are 6 hospitalist teams that patients can be part of. Each team rotates interns, residents, and attendings each week, and overnight, new interns and residents rotate in and out every 7 days. The inconsistency of providers sometimes causes a lack of communication and trust within the nurse and the provider. Broad communication resources have also been discussed among the nursing staff as an issue in our organization. There are many ways to reach providers, including pagers, phone numbers, and facility-issued phones. Also, working in a busy unit, there is usually a resident on our floor who is easy to reach. Because of this, and these many communication opportunities, there can often be miscommunication barrier, even lack of responsive communication between physicians and nurses. An excellent example would be what happened within my organization. Nurses not being taken seriously or being undervalued or underappreciated is an issue that is frequently discussed within my organization. Oftentimes, interns will come to the organization calling shots and thinking they're above other people within the organization, which can sometimes be very difficult, making nurses and other staff feel undervalued and unappreciated as if they lack knowledge. This can eventually lead nurses seeking employment at smaller regional hospitals or even away from the bedside in smaller clinics, where communication is more efficient with attendings rather than interns. I personally have experienced this, leaving my organization full-time and going part-time and accepting a PRN position at a smaller regional hospital closer to my hometown. Organizations are formed on 2 patterns: patterns of meaning and patterns of relating. Patterns of meaning focus on specific themes in each organization or the organization's mission and vision. Meanwhile, patterns of relating focus on how employees interact with one another and the organization's culture. Patterns of meaning within an organization consist of themes. These themes often compromise the company's mission and vision and help shape the organization. My organization's mission includes providing the finest pediatric health services to all children in an environment that fosters excellence in research and medical education. My organization's vision is to provide excellent patient care through innovative and proven clinical care, education, and research. Patterns of relating can be described as how people or employees interact with one another in the organization or the organization's culture. My organization is ranked among the top 20 employers in the state of Alabama and is home to over 5,000 employees. Working with the state's most prominent pediatric trauma center, I find the culture amazing, upbeat, and cheerful. Because the organization is a nonprofit, everyone who works here is here for the patients and experience, not the money. However, working at this large teaching hospital means that students, interns, and even residents are on your unit to make calls above all, which can sometimes be frustrating and clash with the upbeat, happy culture that the nurses have. However, 83% of Children's of Alabama employees should recommend working there, and also, our organization is rated a 4.7 out of 5 stars for culture, values, and career opportunities. However, from conversations with coworkers, we know that organizations such as these have both pros and cons, which can lead to miscommunication and other issues. Ways of speaking or talking in organizations are patterns that reinforce or stabilize culture. Each conversation one has presents an opportunity for reinforcing values and stabilizing culture. Ways of talking can be both good and bad. First, the example within my organization was a negative communication example that led to miscommunication and frustration, which many other nurses in my organization sometimes feel. However, when learning healthy conversations and communication, one can adequately voice one's needs or concerns, leading to more positive outcomes for the patient and the organization. Communication is a collaborative process of gestures and responses that constitute meaning. Listening to others is essential to communication and collaboration, especially between healthcare professionals. In the example of miscommunication within my organization, if there had been more listening between the intern and I, there might not have been the miscommunication regarding the patient's condition or diagnosis. Sometimes we must listen between the words to listen to the words themselves to understand the entire message. Mindfulness, on the contrary, can be defined as being aware or awake in the present moment. Being mindful of those around you means being present in the conversation and action. Developing mindfulness in practice is an excellent way to cultivate the ability to participate in organization as conversation. When mindful, one is open to new ideas and innovations that others might have. In the example of miscommunication in the workplace that occurred within my organization, neither the intern nor I were very mindful to one another. I would have realized the intern's perspective on the patient's condition if I had been more mindful of him. and if the intern had been shown mindfulness towards me, he would have understood my concerns regarding the patient and their condition. Misunderstanding is often required for innovation to occur, helping build and maintain trusting relationships in a trusting organization. Whether through communication or other interventions, innovation in healthcare organizations can improve patient outcomes and care coordination among staff members. Increasing healthcare organizations' innovation readiness is necessary to meet upcoming challenges, including new healthcare challenges, staff shortages, and staff communication. In the example of miscommunication that occurred within my organization, we see how the event could have led to bad outcomes for the patient. However, since the event, me and the intern have had some takeaways that will help us in our future endeavors as healthcare professionals, leading to innovation within our organization. Commitment to innovation concerns organizational actions aimed at individual employees' attitudes, training, and development to support their readiness to improve innovation. Because this event happened and me and the intern were able to reflect, we see how this innovation has occurred within my organization and changed the organization for the better. After reflecting on ways of talking, listening, and mindfulness, and how effective communication can lead to innovation within the organization, I will change many things about how this event occurred. First, through review of the patterns of relating within my organization, I see the core values and standards to which our employees are held. We are all equal, and for the same reason, to advocate and provide for the best of our children across the state. I reflected on ways to communicate better with others through discussing ways of talking, listening, and mindfulness. I realized that being mindful and putting yourself in someone else's shoes can help you realize the person's perspective on a situation. Reflecting and coming to the realizations such as this help to shape healthcare innovation. Overall, leadership that focuses on healthcare excellence and quality improvement and promotes effective meeting processes is found to foster governance. So, let's rewrite this story. While working in the pediatric critical care unit, I was taking care of a toddler diagnosed with croup secondary to a viral infection. A new cohort of interns had recently started working the night shift and covering for the attendings overnight. The patient I was taking care of had IV access and had already received a dose of IV steroids and nebulizers prior to admission to the unit. The patient was calm sleeping and started dropping her oxygen saturations to the 80s. I noticed the intern walking down the hall and asked him to come assess the patient. I gave the intern a brief patient history while he went to the patient's room and told the intern that the patient probably needed to be transferred to another unit to be placed on Heliox. The intern assessed the patient through the window and noticed that she was sleeping, and said it was okay for her O2 sats to remain low as long as they did not keep falling. I asked the intern to go in and assess the patient at the bedside, face to face, to understand my concerns in case the patient were to worsen overnight. The resident did, to which she still stated no concerns at the present moment. Throughout the night, the patient continued to drop her saturations, to which I could do no intervention. After paging the intern and stating my concerns, we were able to get some interventions for the patient. Since I could efficiently and effectively communicate with the intern, my concerns were heard and interventions were done. Since the patient was not getting any better, the patient was transferred to a high level of care and eventually stabilized.